Hi everyone, welcome back to Ultrasound Unplugged and happy Friday. I'm Destiny. I'm gonna be your host today as usual. And then today we've got a really special episode. It's gonna be about Breast Cancer Awareness Month and all things about educational, the educational perspective at least on breast cancer and our ultrasounds. And we're going to be diving in how those ultrasounds play a role in all of that. And today, we're going to have our team here today for the podcast again. So I'll let everyone introduce themselves.
Hello again, I'm Nash. I am the social media coordinator here at Ultrasound Services.
I'm Chris Merkel. I'm the video editor and part of the marketing team at Ultrasound Services.
Hi, my name is Christopher. I'm the co-owner of Ultrasound Services.
Okay, well, now that we've all kind of introduced ourselves, we can go ahead and get into it. Are y'all ready?
Yes.
Yes.
Okay. So, I'm going to start off with just kind of some basic questions, maybe to get us on the same page. So my first question is going to be, what exactly is a breast ultrasound? Any of y'all can answer this.
An ultrasound of the breast?
Mm-hmm.
That's literally what I know of it.
Oh, okay. Well, okay, so if I'm going to explain, it's an ultrasound uses sound waves to create images of breast tissue. So it doesn't have radiation, it's non-invasive, and it's safe and painless. It's often used for dense breast tissue, or if there's like a lump, it's to be able to investigate that without or after, most of the time, having a mammogram or some type of exam with a doctor. And so my next question, and I want someone else to answer, is going to be, when would someone need a breast ultrasound?
And
what do you think?
if they have a negative mammogram report.
A negative mammogram report?
That means there's findings on it that need to be
explored.
like
further, like a lump or
Yep.
something like that. Okay.
Yeah, I was going to say when you feel something too, maybe perhaps.
Yeah, okay, so usually it's like whenever there's something unusual, as you guys said, or if the mammogram results are unclear. So if there's, like you guys said, a lump, or a lot of the time, and from like people that I know as well, if there's like pain in a certain area and maybe the mammogram is inconclusive, like they can't necessarily diagnose just from the mammogram, or there's dense tissue where the mammogram also can't really, it's harder to read, so that's why ultrasounds would be better in that case. So usually, especially here, from when I worked in reception and up till now, for the most part, the ultrasounds are usually ordered as a follow-up exam, or they're like ordered initially with the mammogram. But it's rarely done on its own, I would say. Usually mammograms are the more detailed in that sense, and ultrasounds are more like supplemental.
Yeah.
They go hand in hand.
Yeah. But so why do you guys think that Breast Cancer Awareness Month is so important?
I think it kind of serves as a reminder for those, who need to get checked, and it's kind of like a support as well for those who have or may have. So.
I agree. Do you guys have like any other idea?
I think it does show awareness because of how the rate of it keeps increasing every year, and it's more and more.
Oh, really?
And,
does it? I didn't know that.
1 in 8
I didn't
women.
know that.
Yeah.
Wow.
1 in 8 women. That's pretty.
But it increases every year?
I would assume that
roughly,
if the population's increasing.
Yeah.
Oh, okay. Okay, well, then that just means the ratio is still the same, but
Possibly.
Okay.
But
That's interesting.
But you got to remember, if you're increasing awareness too, the likelihood of you finding
people finding it.
Exactly.
That makes sense.
That does make sense.
Well, I guess that's why it's important, and also I think it's
allowing for early detection.
Yeah.
It's allowing for more comprehensive detection.
Mm-hmm.
Some folks are starting to recognize that they need to do both exams, like the mammogram. Some folks don't want to do mammograms because they don't like the way they feel.
Yeah.
And so now you're increasing what you're doing, your ability to see things, and so it's going to, that changes things. You're likely going to find something
better if you're doing both, mammogram and breast ultrasound.
Yeah. as opposed to just one. Like if it's dense and you're not going to be seeing, you're not going to see anything, of course.
Yeah.
So.
Yeah, I think also on top of like for it being important for the community, but I think it's also important for like the medical community because I think it pushes research on top of that. It pushes donating, it pushes research, it pushes the idea that we should continue to strive to find a solution rather than just putting it in the back of your mind.
Yeah.
So I think that's one of the things that makes it really important. I mean, I know there's other, I think last month was like prostate cancer awareness month or something.
Was it?
I think it's next month.
Is it next month? No, I think it was last month. But just things like that, I think, keep doctors, keep it in their minds and keep them proactive at trying to find something for that. So, if you guys don't have anything else, we can go ahead and move on to the next one.
Yeah.
So we were talking about, Breast Cancer Awareness Month, how it's not just about, pink and pink ribbons, even though we like to decorate with that for the most part. It's also about helping people feel confident and understanding their options. And one of those options, as we mentioned, is an ultrasound.
Right.
So we're going to be talking about what a breast ultrasound looks like, and specifically what it looks like here at Ultrasound Services. So for anyone listening who's maybe never had a breast ultrasound, I mean, I don't think any of us, I don't want to speak for everybody. I haven't had a breast ultrasound. I've had a thyroid ultrasound, but it's not really the same thing. So we're going to walk through what that actually looks like here. And then, so I'm just going to ask you guys, can you guys maybe paint a picture of what a patient could expect whenever they come in for one?
You mean when they come in?
Yeah, like start from the beginning.
Well, I mean, of course, they check in like any other visit for an ultrasound.
Yeah.
It's calm, private, like peer-to-peer. And then they, I would say they would go with their certified sonographer to explain everything before they go into it. They have a discussion, and patient lies back on the bed, and then that's when they start doing the scanning, I assume.
Yeah, they'll add the warm gel too.
Oh, yeah.
We keep
Cold.
it warm so it's not uncomfortable.
Like
We actually were talking about
Getting the cold gel today.
in the episode with Diana, we were talking about why the gel is actually needed because it like fills the air pockets for the sound waves to go through, which is really cool to me actually.
Right.
Yeah, that was pretty interesting.
I wonder what it would look like if you didn't add the gel.
You can't see it.
It doesn't show at all?
It doesn't show at all.
Really?
It shows just barely, but it needs a conductor for the sound waves to go through.
Oh, that's
Yeah. So when you set the transducer like this on your skin, if it's turned on, it's got power, you'll see just a little bit, like just a little bit of the top layer of your skin. But if you throw gel
like
under,
because your skin, but like why can't you see?
it's a
You know what I'm saying?
Yeah.
it allows the sound waves to flow through all the way.
But so it doesn't flow through your
You said
skin?
it fills the pockets? That's
Yeah,
what it
but
does.
you should still be able to see. Just
You can see, but just barely. Once you
okay.
throw the y'all keep talking and I'll show you.
I wonder, like, why the air pockets cause it to not show.
That's weird.
I don't know. Because you would think sound waves travel through not through anything. But I
think
mean, I guess you can't really hear if you're, like, outside and we're talking.
I think it relates to, like, not chemistry, but, like, there's, like, a certain type of way of how...
It's physics.
You're actually going to show us?
Yeah.
Oh.
Yeah, so
That's cool.
I will show, while we're talking about this, I'll show you what it looks like with just regular.
Yeah.
And then we'll put gel on it, and you'll see how the whole bottom half of the arc for the picture opens up.
Okay.
Like literally, you can see just barely, and then all of a sudden, poof, you can see a lot.
That's cool.
Yeah, so give me a second, I'll start this up.
To all
Well-
to all the audio only listeners, we're about to do a mini ultrasound at the moment.
Yeah. We're like...
We're going to look at images, basically.
Well,
It's
while
not-
we're
it's
waiting
not-
for that to
it's not
load, we
warm
can-
though, so but patients would get warm gel.
Yeah. Well, during the exam, obviously, after they get the warm gel gets put on, they'll go ahead and put the transducer on the area, and then depending on if it's one side or both, the tech usually kind of will. They can't necessarily diagnose anything, but if you have questions, they can do their best to answer them about the process for the most part. And it takes around 15 to 30 minutes, depending on, like I said, if you're doing one side or both. And like we said, it's not painful, it's not invasive, and you don't have to worry about radiation or anything. So if you are, pregnant or anything like that, you wouldn't have to worry. So they can just go back right to their daily activities after that. And we're gonna go ahead and wait for this to load.
It's almost out.
I actually have never gotten an ultrasound, like, truly, like, a diagnostic one. I only got thyroid ultrasound because Diana was explaining it to me. So...
How did that feel?
You're a test case?
It was... At first, I thought I would feel more from it, to be honest. But it didn't feel anything. Like, literally nothing.
Yeah.
It just feels like... You feel the gel more than anything, to be honest. And only at first.
I think when I did it, I was even falling asleep.
It was kind of relaxing, yeah.
Yeah.
It was,
so,
like a massage.
So right now it's got the adult echo probe in. So let's use that one. I don't want to change probes. This is a tiny probe. Got to get between the rib cage. Okay. So you see the top right here?
Mm-hmm.
You see how you can barely see anything right now? So I'm going to put this on here. And you see just a little bit? Like,
there's literally nothing.
Exactly. Watch right here really closely.
How would it not show it, though?
Yeah, it's just
I mean,
pushed
I
back.
see, like, on that side, but there's nothing.
Anything.
There's nothing.
Yeah.
Exactly. There's nothing.
But
in it.
why? I want to know the
There's-
down to, like, the
It's
molecules,
kinda like
why
It doesn't have
hurts.
anything to travel through. That's why. So watch
But
what
sound doesn't
watch what
travel through
happens.
skin?
Watch what happens when
Or
I
is that a
watch
stupid
what happens
question?
when I just put gel on it. Oh,
It's
hello.
kind of like a lens.
I
to it.
guess.
Yeah.
Hold on 1 second. Gonna make a mess here.
Should you do, like, ultrasound?
You see how
ASMR?
bright that got?
Whoa! That's actually cool.
Yeah.
Okay, so that's the difference between not having it and having it. Now watch what happens when I put this on my.
Dude, what?
You see?
I want
It's
to know more.
It's able to penetrate because it's got something between it that conducts or allows the sound waves to go through.
Is there anything, like, special about the gel?
Well, I was about to say, what if you did a different gel?
Yeah.
Like
Now-
a random gel.
Water. It's just water. It just says it's made with water, I guess.
Could you just...
But do you see how much better it is?
Yeah,
with-
you can
Yeah.
see everything.
Like you can see
actively.
everything.
You couldn't see.
You couldn't see anything earlier. So if I wipe this off, can you hand me
Oh.
one of those napkins over there,
Yes.
Nash? So that's the difference. Like putting this on a breast, you're actually able to see into the breast.
I would like
So-
to see what, like, regular breast tissue looks like versus dense breast
I
tissue.
feel
That
like
would
the
be
only,
interesting.
I feel
Yeah,
like
right.
the only way
Up,
to do that
one drawer
would
up
be...
to your left.
Could that be through X-ray?
No,
Yeah.
that would be through the ultrasound.
Yeah, just a couple, Nash. So you can see, you see how it went back to nothing?
Yeah.
I took it off the gel. So that's the difference between, look at, okay, so I've wiped most of the gel off of it. I'm going to put it back on with no gel.
That's so weird.
see?
That's
Yeah.
crazy.
So this is what we see when we see a
I wonder
breast.
who realized
Look at that.
they needed
All I did
that.
was set it
Yeah.
on the gel. And look how much you can see.
That's so cool.
And you can zoom in, you can open up the arc of that, and you can see deeper and deeper. But yeah, without the gel,
Literally don't see.
and the
anything.
warmness of the gel doesn't necessarily.
Yeah, it doesn't do anything.
You can
for
do
that.
it without
It's
it
just
being warm,
less-
but that's just for
It's just for comfort.
that's for
Yeah.
comfort. Yeah.
Yeah.
Okay. So now
I
we.
can't imagine places that don't use warm gel.
I know.
That would
I-
be so uncomfortable.
I know.
It was funny when one time I got my thyroid scan and it was cold. It was...
Really?
I felt weird. It felt so weird.
Remind me to wipe that
I didn't
off.
even know places
Yeah.
still do it that way.
So, well, since none of us are really in scan rooms, were you surprised by what we learned?
I mean,
today?
that was surprising.
Right? I didn't know it was that
that
much of a difference. I thought it was just to make it more clear and not like
Yeah.
to make you able to see.
No, that's
completely.
to actually make it
I'm-
see. Yeah.
I'm curious about other gels though. I would
Right?
definitely want to try.
We
this.
should like try. Well,
They have other
I
gels.
wonder if
but
you like put lotion, if that would do anything.
Yeah, like
Right?
that's what I mean. Like something.
I feel like
different.
maybe like a gel lotion. I feel like that.
If it
I
would
think
work,
it's a
yeah.
consistency.
Maybe.
These are meant to be used. This was meant to be used with a probe.
But see, like our question is why.
It's water soluble. It's it's the most conductive. It helps it to be able to go through it.
So but see if any other gel was.
And it's hypoallergenic in case somebody they're allergic to fragrances or something like that. Then they won't get irritated by it.
Mm-hmm.
Remember, we're talking about. Remember, y'all, we're talking about breast ultrasounds. So you don't want to be rolling around like itching after you get scanned.
Oh yeah, no. We were just thinking like hypothetically, like if you were like testing them.
Yeah, that's crazy, but interesting.
Okay, well, we're gonna go ahead and move on to the next segment, though. Okay. So we're gonna play a game. So we played this game before, but we're gonna relate it to our topic now.
That was fun.
It's going to be the myth or fact game. So we're going to do a breast edition. So I'm going to read a statement, and each of you say whether you think it's a fact or a myth. Okay, and we have these little cards if you're watching it, like on YouTube or something. So
if you're not, we encourage you to go
watch
on YouTube.
I would. It's probably more entertaining that way. But so my first statement is going to be breast ultrasounds replace mammograms. I'm not going to. Well, actually, I'll play. I'm going to say that's a myth.
I agree.
Yeah.
Okay, yeah. We're correct.
I don't need to look at the answer.
We talked about it earlier that they don't replace mammograms because mammograms are more detailed and they complement each other. So mammograms will find certain things, and then the ultrasounds will be able to enhance, give deeper explanation as to why that's there. Especially, for example, like if there's a lump, the mammogram will detect the lump, but it can't necessarily tell you what the lump is. So the ultrasound would be better at like telling you whether it's a cyst or like a dense lump that you would have to get maybe like a biopsy for or something like that, which I think is cool. So we read about that one. My next one is going to be that men can get breast cancer too, which I think this is a fact, but it's actually okay. Yeah, so it is a fact, but it's actually a surprising one because even though they do, it's actually only 1% of cases are in men, which is insane. I mean, 1 in 8 women get it, and you're telling me 1% of men get it? Like,
I feel like
crazy.
The percentage would be a little high. I'm not like 50%, but like somewhere in the
right,
15% at least or something. I was expecting kind of higher.
I'm sure it's because of like the difference in tissue.
It's a gene. If you Google it, AI tells you it's a gene that the male can carry, and about 2,800 people get it a year annually. So not very many males get it. Yeah. That's why they consider it rare. But I mean, we've seen several men coming in over the years for breast ultrasounds.
But I wonder if that's why, or if they were like having.
I mean, we have breast pain just like.
Yeah, that's what I was
going
to say. Like, it's just,
so it could be a gene or it could be, something else.
Something else, yeah.
Yeah, and so we still have to look and see if, what's going on. So it is rare, but, we still look.
Yeah.
It's going to be one of my new fun facts, actually. Let's
make a post about that, actually.
Yeah, right? Honestly. Yeah. That was an interesting thing to learn today. But so my next one's going to be that breast ultrasounds use radiation, which I already said this earlier, so everyone should get this right.
Yeah.
It's a myth. So we said earlier that they don't use radiation. Ultrasound, not just breast ultrasounds, but ultrasounds in general, they use sound waves.
Right. So. We just did an example of sound waves going through. Like, if you don't put something on your skin, you're not going to get the sound wave to go through. So you don't have to worry. There's no radiation. It's just harmless.
Yeah. But so next one, you only need an ultrasound if you feel a lump in your breast. I'd say is a myth. I mean, you would need an ultrasound for a multitude of things, first of all. Yeah. But also, like, for example, we talked about having dense breast tissue, or just a follow-up. Sometimes people who have had breast cancer in the past, maybe they're in remission or something, they obviously need to get routine mammograms, and they'll just get routine ultrasounds just to check. So there might not even be a distinct reason in the moment, other than to double check and follow up on it.
You can also have breast ultrasounds for implants. You can see if they're leaking.
Yeah.
It is very distinct on the images. If you see a leak, you can tell it's an actual leak.
I actually
people get them too before getting breast implants just to double check that it's
in the right
safe
way.
And how to. I'm not a tech, so I don't know all the details, but yeah.
It's pretty cool.
Yeah. So next one, you should always skip screenings if you have no family history.
Ooh.
Okay, that's odd.
That sounds silly in my opinion. I mean, obviously, I think any girl especially should always, like, once you get up to your 20s at least, should always be kind of just checking, like, when you're in the shower or, like, when you're in bed. Like, my mom used to tell me that, like, once I started getting older. So, I mean, and we don't have family history of that, but I know that, I mean, why even take the risk?
And I think this is why it's so rare in guys, because we never talk about.
Really?
We don't talk.
Oh, yeah. Well, I guess you wouldn't have to.
We don't ever talk about checking your breast for breast problems. I guess it just never comes up. And then when somebody does have pain, it's so out of the blue or odd that somebody's like, okay, maybe we should go get that checked finally.
Yeah.
Because... You know, you didn't just pump iron and you're like, your pecs are hurting.
Most of the time it's like, oh, just walk it off is just pain. Because we don't.
And I think
I think if a girl feels pain there, like, it's concerning.
Yeah.
Like, immediately, I would say. Unless it's just, like, soreness. But I'd say, like, I know in my family there's been, like, scares. Yeah. Like, I feel like, because, you know, especially after a pregnancy, sometimes milk ducts, like, get clogged. So it causes, like, a lump of... like, I think it's, like, calcium, or I don't remember what it was. But, like, it's scary. Like, they get concerned immediately, which is...
And I think that's the difference. This is why it's kind of good to talk about this, the education of it. Just knowing that some people talk about it, and some people never talk about it.
Yeah.
Maybe, though, that half of the people should talk about it.
Yeah, and I think if there is a guy... who's with a girl that the girl is starting to have something, like a symptom or something, I think the guy should put himself in her perspective and actually take it seriously rather than just be like, oh, it's probably nothing. Because it's nothing to them.
They should go so far as to have the conversations with both of them checking rather than just one person checking. Yeah. Both people should be checking.
Exactly. And
hey.
And I know, like, one side of my family has a history of cancer. Of course, it's different. It would be, like, different things like thyroid or brain or... But most of the time, a majority of the women always do just check for breasts because it could be that as well. Since
like the gene, like you have that genetic factor already. So
I wouldn't encourage anybody to check after, only when they're feeling the pain.
Right.
Like, go regularly.
Because I feel like once you have, if you are in that position, you do have, like, if you do end up having cancer and you were having pain, it could be, like, I feel like once you have pain, maybe it's farther along than...
Yeah, exactly.
Like, if you weren't having pain. So...
But some people are really like that. They're like, no, not until I feel something. I'm not going to come to the doctor.
Yeah, that's... Yeah. I'm like that if I'm sick, I'd say. Like, I'm not going to go to the doctor unless I genuinely feel like I'm going to die. Yeah. Like, which is not usual. I'm gonna move on. Yeah, so the next one, breast ultrasounds hurt, which we also said this earlier. Yeah. It's a myth. Yeah. Honestly, I think ultrasounds can be kind of relaxing. Yeah. From the little experiences that I've had. Maybe if you're having pain, it'd be different, I guess.
I do know, like, the only time I wouldn't say it's not pain. It's just a weird.
It's a weird feeling,
like especially when around the rib cage.
That would be kind of. I didn't even think about that.
Yeah. That tickles.
Yeah. Okay.
Yeah.
Like.
We can deal with that.
But
I'm like, man, that tickles.
But like actual pain, there's no.
No.
Yeah.
I think with the echo, what he's talking about is like the echocardiograms. You got to lay on your side a little. You're not just lay flat. You have to turn.
Oh.
And that turning and staying in that position and breathing is kind of awkward.
That is weird.
And I'm going to be honest, I don't like it either. But it's not painful. It's just awkward. It's like I don't want to lay like this.
Yeah. I guess.
But it's a fast process. So.
But I mean, that's not breast ultrasounds. Breast ultrasounds, you're just laying flat.
Yeah. I wonder if they make them turn to the side though.
So they can see in the ribs.
Yeah. Well, like ribs. I wonder, for breast, we'd have to ask one of the techs, if they make them turn to the side so you can get.
I
don't think
for certain.
Really?
Maybe like if there's pain on the side.
Like the axilla.
Maybe they won't make them move because you can still get it laying down. I don't know. We'd have to talk to them about that. But
we'll have Shannon come in.
Yeah. The next one, you can get a breast ultrasound at Ultrasound-services. That's a fact. No, okay. We're not even going to use the cards for that one. Yes, you can. At all of our locations, you can get a breast ultrasound. But I'm gonna move on to the next game. So I don't think we're gonna use the cards anymore, but I'm gonna. Basically, it's called Finish the Phrase, and I'm gonna state a phrase about breast cancer awareness or just health in general, and you guys are gonna finish it with what you think, which don't look at anything. So the first one is early detection saves.
We have to say it in 1, 2.
Oh yeah,
That's
like okay.
Yeah, we have to say it at the same time.
So, well, y'all could just say it like right after I finish.
Yeah.
So don't even think about it. Just the first thing that comes to your mind. So early detection saves.
Boobies.
You're all correct.
Yeah.
Well, that's true.
Yeah, it is true. In a way.
Fact.
Lives.
A fun fact, another one to add to my list. I have a list of them actually. Is that finding cancer early improves survival up to 99%. At different localized stages or something, which I think that's insane.
What percent?
99.
Wow.
That's crazy.
Yeah, that's amazing.
I wonder,
really
like,
good.
I wonder what the process is after, even with early detection. Like, what they would need to do.
Do they calculate that after the like all that? Do they calculate? I'm assuming so.
What?
Like the chance of the percentage of what you said.
Yeah, you lost.
I'm really.
What was that again? You want to run that by us again?
I think I'm
they calculate the percentage after they find it.
Yeah.
Probably.
Okay.
Yeah.
I
would say because they can't calculate it without knowing.
Yeah.
But so anyways, we're gonna start right after I finish saying it. So October is
Breast Cancer Awareness Month.
Okay.
BCA.
That was good.
Yeah.
That was good.
For short.
It's a month for education, support, advocacy, research, all of those great things. So my next one. You should always check your
breast
attitude.
That has nothing to do
breast.
with
Yes, your breast.
Yes.
But in general.
So whether it's like self exams, while we were talking about in the shower, maybe like before bed.
Yeah.
Also getting routines, scans or mammograms. Is also
I'm
important.
just gonna go out on a limb here and say for guys, they just need to do it because we don't.
Y'all probably need to check other things.
I mean, I feel like
they need it. I mean,
that's why it's like.
I feel like if it's like you feel the pain but not like workout pain, that's when you should probably be.
Like if it's consistent, unusual pain. But also like talking about cancer in general, like me personally, I don't know, maybe I'm just paranoid, but like I'm always making sure I don't have any weird like different like spots on my skin.
Oh.
Because like sometimes they can be sunspots or something, or like I can't tell if maybe I have a freckle or like I check for that. I don't know if y'all, but I do that a lot.
Yeah.
So y'all should check for that too.
We will do that.
Okay, nice one. So mammograms are for
early detection.
What?
What?
Is it only for early detection though?
Yeah.
I wonder if that's the only purpose of mammograms.
No,
probably not, right?
Well, I know.
I mean, you can check for cysts, you can check for clogs.
Proper placement of.
You can. Do they do mammograms for breast implants?
Yes.
That makes sense.
Oh.
Yeah. So I guess there's a lot of different things, but you were correct.
Thank you. I appreciate it.
Okay.
When I'm not being pranked, I like that.
Okay, my next one. Ultrasound helps. You guys have to say it. The first thing.
Always.
It helps to see what mammograms might miss.
Okay.
There you go. Yeah.
That's a good one. So.
See, I think of multiple things, and it's like
just the first one.
There's so
first
many,
one.
Yeah.
I mean, there's multiple right answers. I mean, they can see. We said it earlier again. Dense tissue. They can see. How lumps. The makeup of the lumps for the most part. And then that's I could probably differentiate other things.
The thing that comes to my mind when people say mammograms, it seems like women don't want to do them, and they come to our office and they're like, I don't want to do the mammogram, so we have to write that they refused or didn't give us a report for the final report, and it's they go hand in hand, and so you're possibly deferring or delaying something that you really should get done, even though it's like.
Well, I would imagine if you're having pain, that would hurt even more.
Right.
Like the mammograms, I would say. Well, I wouldn't say from experience, but I would imagine that they hurt, especially if you already have pain.
Right.
So, but we digress. So, I have two more. The first one is pink means
support and awareness.
Awareness. Yes.
Yeah, I would say awareness is a good answer. I think the pink ribbon has become like a global symbol. Which is
Oh yeah,
cool.
no, it's extremely recognizable, and anytime I see them, like I immediately know what it.
I wonder who came up with that.
Right.
Susan G. Combs? I don't know.
I was like, how do you know that?
I don't know. I think that's where I first saw it was with their run.
Oh, okay.
Yeah.
I don't remember when I first saw
And
that. I was probably like 5.
It's been a long time.
Yeah.
And I think I started seeing it when y'all opened up y'all's first office, and y'all.
I would
showed
see it
us-
like in elementary.
That was back when we were doing a collection for breast ultrasound.
Oh, the like bra donation or something?
Yeah.
Mm-hmm.
That'd be cool. My last one. So, support, screen, and
Spread awareness.
spread awareness is
I was gonna
survive.
No, I was gonna say save lives,
Oh.
not
Survive would be
survival.
great.
I don't like the word survive.
Yeah, survive.
Personally. Like, even if you go through something like
Survival of the fittest.
that. Yeah, like it sounds so.
Jeez.
That was
I used to say that all
literally
the time.
like the motto of my major for the most part. Oh my god.
So just so y'all know, it was in the 1990s.
Oh,
A
what?
la-
That's
a
not
lady,
even that long ago.
an activist by the name of Charlotte Haley, who
Oh,
created the peach-colored ribbons in the early 90s for breast cancer awareness.
It started off as peach color.
Mm-hmm.
So it wasn't pink.
Estee Lauder then chose pink
Mm.
instead for 92 Breast Cancer Awareness Month.
Oh.
The campaign solidifying the pink ribbon.
Yeah,
It would be
guess it makes more
interesting.
sense.
Estee
If,
Lauders, that's so random.
it would be interesting. They
Right.
brought back the color as kind of like a retro type of.
Yeah,
nostalgia.
that would be cool. But I wonder if anyone even knows that. I wonder if she even gets the credit for that.
Right?
Like, that would suck.
Nobody remembers the name.
Yeah,
And we
I wouldn't
should.
have known that.
And we
Yeah. Well.
Thank you, Google.
Okay, well, that was the end of my second game. So, I actually really like this podcast. I learned a lot, and I added fun facts to my list. So, I think that this month is really important for so many reasons, and we really, especially here, whenever we think about breast ultrasounds, we really hope that we can deliver that early detection to the patients that need them. And because we know that can truly save lives.
If you are due for a screening, make the call, do the screening.
Mm-hmm.
Go get your mammogram done. Don't skip those. Do the breast ultrasounds if you need to, or both. Just don't put it off.
Mm-hmm. If you're not sure what's right for you, I would say talk to your provider as well.
Yeah.
And if you do have a family history, I would say look into that as well. Do research. And of course, the moment you start feeling pain in that certain area, especially when you have family history,
Don't put it off.
Yeah, do not. It's and also for males, if you start feeling pain as well, go.
Yeah, you could be part of that 1%.
Yeah.
So, hopefully not. But thanks for tuning in to our podcast today. It's Ultrasound Unplugged. We're here every Friday. We post it on YouTube if you want to see the actual visuals and the ultrasounds that we were doing today. And we're going to be maybe doing some more, whether it's IVF or breast cancer awareness. You can always come back and see. And we will catch you next week. We hope you have a great weekend.
Yes.
Bye.
Bye.